Good morning. Welcome back to House Government Operations and Military Affairs. It is Wednesday, January 22nd, 9:30. We again have our friends from the Secretary of State's office to do a overview of the Office of Professional Regulation. I scheduled a little bit of extra time above and beyond a brief overview because we do traditionally start the OPR bill in this committee. And I didn't know if folks had thoughts or things to share on various aspects of that policy and departmental bucket. With that, I'll stop talking and I will invite the Deputy Secretary of State and her General Counsel.
Good morning. Thank you so much for having us. For the record, my name is Lauren Hibbert, Deputy Secretary of State, and I have the pleasure of having with me Jennifer Cohen, who is General Counsel with the Office of Professional Regulation, and also Mike Warren, who is the Interim Director of OPR at this time. So we brought our full crew to you this morning.
Awesome. I love faces to names.
Yes. So the Office of Professional Regulation is one of the 5 divisions within the Secretary of State's office, and it is really dedicated to the public protection of Vermonters through licensure, certification, registration. There are 3 different levels of licensure in Vermont: registration, certification, and licensure of professionals. We regulate over, I think we're at 52, 53 professions at this point. And our mission is really to protect Vermonters from incompetent or unethical behavior across all of these diverse professions. And just to talk a little bit about the diversity of our professions, we regulate, because there are some new members on this committee. For those of you who have been on this committee, this sounds like you know this very well, but we regulate everything from tattooists to architects, dentists, nurses, land surveyors, real estate brokers. Essentially, it is impossible to live our daily life without coming into contact with one of our licensees at least once a week, certainly 2 or 3 times a month, given the fact that we all need all of these professional services. So it's really important that Vermonters are protected, that people are competent to be in the positions that they're in. And then if somebody steps outside of what is expected behavior, again, incompetent or unethical behavior, we have an enforcement division that investigates those incidences, pursues prosecution actions if necessary, and then holds people accountable. We really firmly believe in good licensure policy, which means we only regulate if we need to. And if we do need to regulate, we regulate at the lowest barrier possible. Jen's going to speak more about that process in a little bit, but it's a very important piece of who we are. And we also have been really needing to adapt to the changing environments. COVID in particular really forced us to do a lot of adaptation and change. We had to do temporary licenses because there were no exams available. Lots of people were graduating from school in 2020. They were ready to practice, but before they needed an exam, there was not the ability to take an exam in 2020. So we needed to spin really quickly and issue temporary licenses for people who were waiting for their exam so they could get into the marketplace and start practicing. We needed to build telehealth licenses because people were not able to come to our state, or people were needing to provide telehealth services in a different capacity, particularly with our small state. We have a lot of patients who come into our state from New York and New Hampshire, and we have a lot of patients who leave our state to go to New Hampshire and New York for services. So we really needed to adapt with telehealth licenses. We needed to issue emergency licenses very quickly. And then we also recently have really been adapting and changing our processes in response to compacts. Compacts are a new thing, relatively new thing that's been happening. I say new, but it's like, 7 or 10 years old. So it's becoming less new as each year. But they're a new thing on the national landscape that allows somebody who's licensed in a different state to come work in our state without having to obtain a license here, or to obtain, there's 2 different models, or to obtain a small license here so we know who they are. So in that big bucket, we have 162 different license types right now, and over 80,000 licensees. And the licensees involve people and entities and businesses. We regulate pharmacies, which is a very, very complicated regulatory space, real estate firms, tattoo shops, funeral homes, electrology shops, and cosmetology, barber and nail technician, estheticians. We also have an inspection division that I haven't touched on yet. An important piece for this committee to understand and an underpinning of OPR is we are a special fund agency. We receive very limited general funds unless we make a specific ask. So when we're standing up new professions in the last several years, we have made a general fund ask. And when we're being asked to do a sunrise report, again, which Jen will talk about in the future, we also have been making a general fund ask. That is because we're funded only by licensees who are currently licensed. And that is our revenue. We have a biennial cycle, so we have lean years and thicker years from a budget perspective. OPR has been running at a deficit. I think we're at our 5th year of running at a deficit. Last year we were asked to do a money study to look at our resources and our plan going forward. We are about to release that report. That report asks for another 2 years to study our money, really because we realized that we had some data gaps in how we were tracking our time specifically to professions. And we want to make sure that we fully understand how we're using our time, which professions are costing us more time versus less time. And we are not coming to you with this year. There's a lot of options that could be on the horizon about how to fund OPR. We just need more data and more understanding before we're ready to make a sustainable recommendation to this body, to this committee, but then to this body on a whole. So I'm happy and excited to talk more about that at a future date once the report is released. But it's a really important piece for OPR. So as I said, our core function is licensing. We do that through setting qualifications in this building, through administrative rulemaking, which builds on the work that's done in this building, and then having a team of people who ensure that every applicant meets the qualifications that are set. We then have an enforcement team that includes 6 certified law enforcement officers. We investigate we receive about 800 complaints a year, 600 to 800, depending on the volume. We investigate about half of those, and we prosecute about 100 cases per year. We are very careful in our investigation process to speak with everybody. We really do everything in our enforcement process to give people due process. And then once someone has been found to have committed unprofessional conduct, that is a public decision available to all Vermonters, and out-of-state folks, licensing entities from other states receive that information as well. And employers have access to that information. And that is a very key part of how we protect the public. And this is all done through our administrative law division. So I'm on slide 4 now. And this map just shows you the diversity of where the in-state licensees are within our state. Naturally, it does track with our population. So you can see, Chittenden County, we're just over 13,000 licensees, whereas Orange, we're at 1,800. So it's a good representation of where our in-state licensees are. The majority of our licensees are healthcare licensees. And the decisions that are made in this building related to OPR and at OPR just have a very significant impact on commerce, on healthcare, law enforcement, and consumer protection. So we track a lot of bills related to those topics because they all ultimately will impact us in some way, shape, or form. And the decisions that we make about a profession in this committee will have an impact on the healthcare system on it, for instance. So when we were moving the nurse licensure compact, we worked very closely with the healthcare systems to understand the impact and benefits for them and healthcare on whole. And with that, I'm going to turn it over to Jen.
Thank you so much. Good morning. For the record, Jen Colin, General Counsel for OPR. So you'll see, starting on slide 5, OPR operates with 2 governance models. We have a board model and we have an advisor model. And our board model has about 14 professions in it right now. Those are the more traditionally regulated professions. They have a lot of practitioners in them, and often there's some level of complexity, like multiple license types under that board. So some examples of our board professions are allied mental health, dental examiners, land surveyors, nursing, pharmacy, psychology. Our 2 biggest boards are dental and nursing. They have about 11 members in both of those. And the pharmacy board's a pretty big board. They're meeting this morning. And our board members are appointed by the governor. The rest of our professions are governed by the advisor model. And for those, 2 to 3 practitioners are appointed by the Secretary of State to serve in that role as advisors. Board members and advisors help OPR by providing subject matter expertise in areas like rulemaking, reviewing qualifications, and helping our enforcement team evaluate complaints and investigations where unprofessional conduct is alleged. Participation as a board member and an advisor is really a public service, and we view it as a significant service to the profession as well. You'll see on slide 6, there are some differences between the 2 models. Boards are, their licensing budgets are siloed, and boards sit as jurors on cases where unprofessional conduct is alleged. So the boards hear those disciplinary cases, they make the decisions in those cases, whereas in advisor professions, those disciplinary hearings go to an administrative law officer, and the advisor fees are pooled. The advisor licensing budget is pooled instead of being siloed like in the board model. Also, board and advisor meetings are subject to open meeting law. And one difference between those 2 models this year has been that with open meeting law changes, board meetings are hybrid with both remote and in-person options for attendees, and the meetings are recorded and posted online. Advisor meetings are not subject to the same requirements, and those continue to be remote. The most recent profession that we've added is peer support, and that is an advisor profession. And we anticipate that this legislative season, we may be onboarding a couple of more professions. You'll be hearing more about community-based perinatal doulas, and you'll also be hearing about early childhood educators this year. And that leads me to slide 7, which gives us a brief look at what we call a sunrise review. So when individuals or groups request that a profession be regulated, it triggers what we call a sunrise review. And that sunrise review is under 26 VSA Chapter 57. That provides the statutory framework for the analysis that goes into determining whether we should regulate a new profession. A sunrise review has 2 major parts. The first is really determining whether restricting entry into the profession, i.e. regulation, whether that serves a public protection need. And if it does, then we assess the least restrictive form of regulation necessary to protect the public. So those are kind of the 2 arms of that analysis. There are various factors in Chapter 57 to make those determinations, including whether there's a recognizable harm that may result from unregulated practice of the profession. And on slide 8, you can see some of that sunrise review statutory language. And I'd like to highlight for you, Lauren mentioned this a minute ago, in subsection B, the language that if there is a demonstrated public protection need to regulate a profession, subsection B says the form of regulation adopted by the state shall be the least restrictive form of regulation necessary to protect the public interest. This language and the factors used to assess the least restrictive form necessary, ensure that we right-size regulation for public protection, but that we don't go beyond and over-regulate through unduly burdensome requirements.
So the way that OPR is structured, we're an umbrella agency. As Jen referenced, we have those 14 boards and the remainder of our professions are advisor professions. Our umbrella structure is found in Title III. So a lot of the provisions that govern the entire office are made in Title III. And that's where we typically make changes that will affect all. That's where the duties of the office are. That's where their fees are set. That's where unprofessional conduct is outlined and standardized across our professions. That's where we have unauthorized practice, which can be an administrative action. It also can be a criminal action, depending on the nature and conduct. We have pursued criminal unauthorized practice for things like unauthorized tattooing. That's where the power for boards and a board and advisor appointments are. And that's where we set out our renewals and application schedules. I don't know why I had struggled so much on saying
It's all good.
it's actually a very simple word, but for whatever reason, it was just challenging for me. So I apologize.
I have those moments too.
Oh, gosh, speaking, still challenging. And then for each profession, you'll find a separate chapter in Title 26. So in Title 26, that's where you'll see a chapter related to nursing, a chapter related to dentistry. And so frequently, when we're creating a profession or when we're modifying a profession, that work is done in Title 26. This year, our OPR bill focuses primarily on Title III, but there is a Title 26 provision. And with our professions that we're recommending, those will be primarily in Title 26 with modifications to Title 23. You might be asking at this moment, how do we do this all? Because we have 42 employees at the Office of Professional Regulation. We're a lean, mean machine. We've been very proud of that, but we are at our max capacity with our professions and our staff. The only way that we have been able, well, let me just pause there. So with our new professions, you can anticipate that we will be asking for some new positions. We really need this committee's support on those new positions. When we come to that discussion, we can articulate that in more detail, but we cannot add more work to this team without adding more people to this team. The only way that we have been able to function, particularly with the complexity of COVID and our new professions and our new licensure pathways, is our IT system. Our IT system, we affectionately call it our next generation licensing platform. Or NGLP, we have a licensee in the room, so I'm hoping that the experience with our licensing system has not been horrid. Looking at a Representative Stone, hoping it hasn't been horrid. Okay, well, we won't go into that too much. So, but it is, we went live with that in 2017, and it has been an adventure. And with all IT systems, there is work to be done, continual work to be done. It has not been as we would, of course, liked it to be cheaper. But the reality is that with the complexity that we have needed to deal with, we needed to spend IT investment to adapt to all of the changes that have been happening. I'm very happy to say that we are coming out of our large spend on our IT system and that we are now moving into more of a maintenance phase. Although the term maintenance phase used to be that an IT platform, you would just go to a very low number for the continuation of the contract. That is just not true anymore because IT systems are expected to change and adapt so rapidly. But the nimbleness of NGLP, the fact that the majority of our renewals are processed within a day, the majority of our applications are processed within 48 hours, which is unheard of across the nation. The ability for us to interact with our licensee applicants within the system. We used to have to mail a letter and then we'd have to receive a letter. We no longer do that. We correspond through the system. And the ability for us to receive complaints online have really modernized and streamlined our process. And we've made substantial and huge changes in the 8 years that we've been in this new system. We do have legislative goals for our OPR bill. The theme is really that we want to create a better balance between access and financial stability. When we release our money report, and I've given you a little bit of a preview on that, we are running at a deficit. Some of the causes are large and not immediately fixable by us. Our employee contract. We do not have control over that, nor do we not want to pay our employees very well. We need to continue to support our Vermont State employees who are really the heart and soul of OPR. Our IT contract, also expensive, very hard for us to severely cut back. Our lease, we lease property at the city center for OPR. We did renegotiate in the beginning of 2023 a new lease, which was incredibly beneficial. We are paying less than we paid in previous fiscal year. And we were very lucky because we signed that lease, I believe, 3 or 4 days before the flood of 2023, when the property at City Center, which did not flood, suddenly became a lot more valuable. So we came in right at the nick. So we have been doing everything we can to be as fiscally responsible and sustainable as possible, but we will need to talk about places where we can generate revenue for things that we've previously offered for free that we think licensees should pay for. So you will see some of those fees in this year's OPR bill. Again, those are not an increase of licensure fees, either initial licensure fees or renewal fees. These are things like verification of good standing for another state, someone who's seeking to be licensed in another state, who's looking for verification from our office. That's a good example. We also plan to open the funeral chapter. This is our one Title 26 modification to strike some provisions related to escrow agents, which is something that doesn't happen anymore. So we would like that out of the statute. And with that, I'll turn it over to Jen to talk about other bills.
Right, so there are quite a few bills out there that we know about at this point. I'm sure there will be more than what's on this list, but you'll see on slide 12, you'll be seeing perinatal community-based doulas, a bill relating to early childhood educators, a bill proposing the expansion of scope of practice for optometry, licensure compacts for dental and dietitians, psychologist prescribing bill, and a bill related to the regulation of septic installers and inspectors. And you'll see on the next page, we have been writing reports like crazy at OPR in recent days, and quite a few of those reports relate to the legislation that you're going to be seeing this year. We've got the OPR Money Study Report, Early Childhood Educator Sunrise Report, the Doula Sunrise Report. And even though it's not on this list, we have a psychologist prescribing report that we expect to be releasing very shortly as well. So there are a few of the reports that we've been doing recently on slide 13.
And with that, we would welcome any questions or concerns this committee may have.
So, I mean, we've had conversations leading up to the session. So we have, the general OPR bill move in the queue, just waiting for details. So
We have it ready for you.
cool. Oh no, that wasn't where's the homework? I was just kind of stating
No,
that.
I mean, it's.
Yeah. And then some of the other pieces, returning members of the committee, remember the conversations that we had around the optometrists and the ophthalmologists. That's going to come back up. I spoke with Senator White about that yesterday. So we are working on doing mirrored language for consistency. And I personally want to really address that with a lot of intent and wrap up that conversation this year. No idea what the details are, but I would really like to just finish this landscape of work on this conversation because you all put so much time and energy into it. And I want to really respect the work that you did to give us policy recommendations on that. I got the language finally on the licensure for early childhood educators yesterday. So that is something I'm going to introduce with, I'm working with Chair Wood on that one. So that's pipelining. Yay, finally got the language.
We have seen that language and agree with it.
Okay, cool. Great starting point. Wonderful. Look at us checking stuff off the list. I think, and then all that other stuff, we can discuss this stuff in greater detail as time goes on. I wanted to circle back to the IT cost question, because that's something that's a little bit in here, but a little bit in Chair James's committee now that she has jurisdiction over some of that stuff. Now, the increase in cost on that, how substantial is that? Like, it seems like it's an escalating expense that wasn't.
Yeah. I would have to get back to you on the
Okay.
precise numbers, but I can tell you, we entered into a contract, a fixed price contract in 2016 for implementation in 17, where both parties underestimated the cost of the system.
Okay.
And then we changed vendors. I sometimes say we had a conscious uncoupling, because
That's one way of putting it.
it was a way it's.
I like that.
We have a new vendor that's been with us since 19, early 2020. And then the work, again, we're still within our contract with our new vendor, but the contract that we entered with our new vendor was higher than what we were anticipating when we initially entered the contract in 16, 17. I'll have to get the exact dates and the exact contract amounts for you if you're interested.
At some point, no rush. I just know that's a big part of like budgeting.
Yeah, well,
This year.
I think a big piece that I would say on whole, representing a state agency is we need to think about as a state building IT funds, capital funds, because IT systems are really expensive and they are now equivalent or probably even more important than the front door to any of our buildings. The majority of our population enters and interacts with us through an IT system. More than our phones, more than our emails, more than our front door. And just like we would have a capital fund to build a new building, we need to start thinking about how we can build resources within state government to build IT systems, because putting that onto 1 or 2 fiscal years is an extreme stressor, and is, while we can anticipate the costs, we can't preserve the money in the same way. So it's just a structural issue that I would love to continue the conversation on. So yes, our IT costs have grown. We have anticipated that growth, but we foresaw it and we've been adjusting to it throughout the years. And now at this point, again, we're very proud to be at a place where we have last fiscal year reduced our costs on IT. The next year, we're anticipating, fiscal year 2026, we're anticipating reduced costs, and we're anticipating that in fiscal year 2027. We're not anticipating changing our IT system in this space, in the OPR space in the near future. So I think our IT costs will continue to drive down. We have made some really smart investments with our IT costs in this platform, particularly something that we call the configurator, which allows an end user, not an IT user, to build an application. And these are applications that are incredibly complicated, where there's, the flow chart for, if you answer this way, what questions should you get? If you answer this way, which questions should you get? If you answer that question incorrectly, can you proceed with your application? Yes or no? If you answered, it's very, very complicated. An end user on our team can now build an application, which is what we built during COVID. It was expensive, but that's what helped us set up all of those emergency licenses, all of those telehealth licenses. We did not spend IT developer time, which bills at about $150 to $175 an hour. That's the going rate. So putting that work into our workforce was a very prudent and sustainable method for OPR to start to contain costs. And that was the decision we made in 2020. And we've been working on that continually. It's gotten more functionality throughout the years. And now we are able to set up an application with our own staff in a very short period of time, testing it out, making sure it works, going back, readjusting it, and then testing it again before we deploy it.
Anything from the Representative Pisano?
Because I'm new, MVR sunset, what is MVR?
Oh, motor vehicle
I
racing.
figured it was, but
So the Office of Professional Regulation has regulated motor vehicle racing for quite some time. We were asked 2 years ago to look into whether the office should continue to regulate motor vehicle racing. We have worked on a report and we are recommending that the legislature consider deregulating motor vehicle racing. We are one of only 5 states in the nation that do so. We do it in a complicated and fiscally expensive manner with inspections. And we believe that the private marketplace, the insurance marketplace, is the appropriate constraint on public safety. So that report, I believe, was released last week, but I'll make sure that it's sent to this committee as well.
Yeah, I think we got 28 reports up on 15.
Yes.
Yeah, I actually just put out a daily list, organized reports.
And you're gonna have that on your daily list for many days, right?
Oh, I know what I signed up for.
But I will make sure that you get the reports that are listed here. I'll make sure you are sent directly so that you have the opportunity to review them. On the motor vehicle racing report, we have not recommended deregulation of a profession for quite some time, but that has always been in the responsibilities of the Office of Professional Regulation. With Sunrise, we also are supposed to do sunsets. And we have done essentially a sunset report on motor vehicle racing. And also, if you look at the real estate regulatory review, it's not a sunset. Please do not take what I'm about to say as we're going to deregulate real estate. We absolutely cannot do that. We really need to be in that space. Vermonters rely on us to be in that space, but we need to look at whether we're doing it in the best way possible. And the real estate regulatory report does look at that and assess whether or not we are regulating the profession correctly. And we have found that there are changes that we can make. A similar report to that is our mental health licensure report, where we looked at how we're regulating all of our mental health professions, very complicated landscape from a qualifications pathway perspective, critical workforce to Vermonters. We believe we can be doing this in a simpler way, in a more unified, streamlined way. And we do not have a bill related to that this year intentionally. We released that report on December 15th, probably with another 25 reports that we received on December 15th. And so I'll make sure that you get that report as well. But we need to continue to work with our stakeholders, and that is going to talk about the changes that we're recommending. And the recommendations within that report are repeal and replace of multiple chapters within 2020 and within Title 26. So that's why it needs to be a 2026 project, because the drafting was too tight given everything else we're working on between December 15th and your legislative drafting deadline.
Understood. Yeah, there's only so much we can do in one time, right? Yes. Any other questions from the committee? No? All right, great. Well, thank you to both of you for, especially Deputy Secretary. I feel like we just need like a tram coming back and forth. Yeah.
In these frigid temperatures, I would love an enclosed tram if I can be full.
Talk to BGS, see what we can do. Yeah. Gondola. Okay, with that, thank you very much. So we got till 10:15 for the next piece. So let's break for 10 minutes and come back to pick up on some bill introduction.